Uterine fibroids are the most common benign tumors of the female reproductive system, occurring in 20 to 30% of females, most often in women aged 30 to 50. In females aged 15 to 54 years, uterine fibroids account for an average of 29% of hospitalizations for gynecological disease. Women who do have symptoms often find fibroids hard to live with. Some have pain and heavy menstrual bleeding. Fibroids also can put pressure on the bladder, causing frequent urination, or the rectum, causing rectal pressure. Should the fibroids get very large, they can cause the abdomen, stomach area, to enlarge, making a woman look pregnant. In this video, we will talk about this disease, uterine fibroids, by answering these questions. What are uterine fibroids? What causes uterine fibroids? Symptoms of uterine fibroids. How's it treated? What are uterine fibroids? Uterine fibroids are tumors that grow in a woman's womb, uterus. These growths are typically not cancerous, benign, and do not become cancerous. In some cases, they can be attached with a thin stem, giving them a mushroom-like appearance. Most uterine fibroids don't cause serious complications. However, the most common complications of fibroids are pain that becomes unmanageable, swelling of your abdomen or pelvic area, excessive bleeding, anemia, infertility. This is rare. Types of uterine fibroids. There are different types of uterine fibroids depending on where they're located and how they attach. Specific types of uterine fibroids include intramural fibroids. These fibroids are embedded into the muscular wall of your uterus. They're the most common type. Submucosal fibroids. These fibroids grow under the inner lining of your uterus. Subserosal fibroids. This type of fibroid grows under the lining of the outer surface of your uterus. They can become quite large and grow into your pelvis. Pedunculated fibroids, the least common type. These fibroids attach to your uterus with a stalk or stem. They're often described as mushroom-like because they have a stalk and then a wider top. What causes uterine fibroids? No one knows for sure what causes fibroids. Researchers think that more than one factor could play a role. These factors could be hormonal, affected by estrogen and progesterone levels. Genetic, runs in families. Because no one knows for sure what causes fibroids, we also don't know what causes them to grow or shrink. We do know that they are under hormonal control, both estrogen and progesterone. They grow rapidly during pregnancy, when hormone levels are high. They shrink when anti-hormone medication is used. They also stop growing or shrink once a woman reaches menopause. Symptoms of uterine fibroids. Many people who have uterine fibroids don't have any symptoms. In those who do, symptoms can be influenced by the location, size, and number of fibroids. The most common symptoms of uterine fibroids include heavy menstrual bleeding or painful periods, longer or more frequent periods, pelvic pressure or pain, frequent urination or trouble urinating, growing stomach area, constipation, pain in the stomach area or lower back or pain during sex. Rarely, a fibroid can cause sudden, serious pain when it outgrows its blood supply and starts to die. Often, fibroids are grouped by their location. Intramural fibroids grow within the muscular wall of the uterus. Submucosal fibroids bulge into the uterine cavity. Subserosal fibroids form on the outside of the uterus. How's it treated? What type of treatment you have depends on your age, your general health, your symptoms, type of fibroids, if you are pregnant, if you want children in the future, location and size of the fibroids. Medications. If you have fibroids and have mild symptoms, your doctor may suggest taking medication. Over-the-counter drugs such as ibuprofen or acetaminophen can be used for mild pain. If you have heavy bleeding during your period, taking an iron supplement can keep you from getting anemia, or correct it if you already are anemic. Several drugs commonly used for birth control can be prescribed to help control symptoms of fibroids. Low-dose birth control pills do not make fibroids grow and can help control heavy bleeding. The same is true of progesterone-like injections, e.g. Depo-Provera. An IUD, intrauterine device, called Mirena contains a small amount of progesterone-like medication, which can be used to control heavy bleeding as well as for birth control. Other drugs used to treat fibroids are gonadotropin-releasing hormone agonists, GnRH. The one most commonly used is Lupron. These drugs, given by injection, nasal spray, or implanted, can shrink your fibroids. Sometimes they are used before surgery to make fibroids easier to remove. Oral therapies. Elagolix is a new oral therapy to manage heavy uterine bleeding in people who haven't experienced menopause with symptomatic uterine fibroids. It can be taken for up to 24 months. Talk to your provider about the pros and cons of this therapy. Another oral therapy, tranexamic acid, treats heavy menstrual bleeding in people with uterine fibroids. Fibroid surgery. Myomectomy is a procedure that allows your provider to remove the fibroids. There are several types of myomectomy. The type of procedure that may work best for you will depend on where your fibroids are located, how big they are, and how many you have. Hysteroscopy. Your provider inserts a scope, a thin, flexible, tube-like tool, through your vagina and cervix and into your uterus. Your provider uses the scope to cut away and remove the fibroids. Laparoscopy. In this procedure, your provider will use a scope to remove the fibroids. Unlike hysteroscopy, this procedure involves placing a few small incisions in your abdomen. This is how the scope will enter and exit your body. Laparotomy. During this procedure, your provider makes one larger incision in your abdomen and removes the fibroids through this one cut. What if I become pregnant and have fibroids? Women who have fibroids are more likely to have problems during pregnancy and delivery. This doesn't mean there will be problems. Most women with fibroids have normal pregnancies. The most common problems seen in women with fibroids are cesarean section. The risk of needing a C-section is 6 times greater for women with fibroids. Baby is breech. The baby is not positioned well for vaginal delivery. Labor fails to progress. Placental abruption. The placenta breaks away from the wall of the uterus before delivery. When this happens, the fetus does not get enough oxygen. Preterm delivery. Talk to your obstetrician if you have fibroids and become pregnant. All obstetricians have experience dealing with fibroids and pregnancy. Most women who have fibroids and become pregnant do not need to see an OB who deals with high-risk pregnancies. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share, and subscribe for the HeInfo channel.